Hi friends, today's topic for the lecture is anatomy of the scalp. This is Dr. Yusuf signing from Al University. The specific objectives related to this topic are: the first one is list the layers of the scalp, second is list the arteries supplying the scalp, third is explain the clinical significance of dangerous layer of the scalp, fourth is name the veins draining the scalp, fifth is list the sensory and motor nerves of the scalp, and sixth is outline the lymphatic drainage of the scalp. So these are the six objectives which we'll try to cover in this lecture. To begin with, coming to the introduction of the scalp, what exactly is the scalp? It is nothing but a thick layer of soft tissue which is covering the calvaria of the skull, that is the skull cap. Calvaria or skull cap, here will be the skull cap, bony part. On that a thick layer of soft tissue is present. That soft tissue is called as the scalp, which is covering the calvaria of the skull. So the extent of the scalp is much more beyond. In the front it will be beginning from the just above the orbit in a bony margin, that is called as the supraorbital margin. If you remember the skull, here will be the supraorbital margin. Then behind, if you go all the way up to the occiput, there we have something called as the external occipital protuberance in the center, and beside that we have the superior nuchal lines. They are superior, inferior as well as the highest, but this will extend up to the superior nuchal line. So here in the center will be the external occipital protuberance, which will be the most prominent part behind in the occiput, and beside that there are lines which are called as the superior nuchal lines on either side. So this is the extent behind, and on the lateral side it will extend up to the zygomatic arch on either side. So this is the whole extent. So in the front it will extend up to the supraorbital margin, goes all the way up to the behind up to the external occipital protuberance as well as the superior nuchal line, and at the side it extends up to the zygomatic arch. So this is the whole extent of the scalp. So the scalp has layers, is multi-layered, and it has 5 layers, and they stand out to be as similar to that of the words of the letter, the word actually the sorry, it should be each letter of the word scalp. So the first letter is S. S stands for the skin, which is the outermost covering of the scalp, which is covered by the skin, and it will be filled with hair. Then we have the second letter is C, and it stands for connective tissue. So this connective tissue, which will be much more dense compared to one more layer where it will be loose. The third letter is A, and this stands for the aponeurosis of the occipitofrontalis muscle. You remember that there is a muscle here deep inside, so which extends from the supraorbital margin up to the occiput, and in between there is an aponeurosis. So initially in the front we have a part of the muscle on either side, and at the end it is partly muscular. The remaining part of this muscle become aponeurotic. So that aponeurosis form the third layer, that is called as the aponeurosis or aponeurotic part of the occipitofrontalis. Then the fourth layer stands for the fourth letter is L, and it stands for the loose connective tissue. L stands for loose connective tissue, or it is also called as the subaponeurotic tissue, which is because subaponeurotic because it is below the aponeurosis. Sub means below, so below the aponeurosis, so it is called a subaponeurotic tissue, or it is nothing but the loose connective tissue. So this connective tissue is different from the connective tissue present in the second layer. Here it is dense, and here it is loose connective tissue. And the fifth layer is the pericranium, or it is nothing but the outer periosteum of the skull. So the skull bones also have the periosteum covering, so that is called as pericranium. because it is covering the cranium, so that's what is called as the pericranium is nothing but the periosteum of the cranium. Okay, so these are the 5 layers of the scalp, beginning from the skin. Then deep inside there is the connective tissue which is dense. Then we have the aponeurotic layer. Then we have the loose connective tissue. Then we have the last layer deep inside, that is the pericranium. So the scalp word with the letters stand for the 5 different layers. So there are 5 layers of the scalp, beginning from superficial to deep: skin, connective tissue, aponeurotic tissue, loose connective tissue, then the pericranium. So these are the 5 layers of the scalp. Now coming to the nerve supply of the scalp. So the scalp is supplied by 10 nerves, 5 in the front and 5 behind. So there are 5 nerves which are supplying in the front of the ear and 5 nerves which are behind the ear, which will supply the whole of the scalp. So there are totally 10 nerves which will be supplying the scalp. So out of these 10 nerves, 8 will be sensory and 2 will be motor. We'll see one by one. So the 5 nerves which are supplying in front of the ear will be from before backwards. The first one will be the supratrochlear. This is the nerve here which is supplying the scalp. The whole thing is the scalp, right? So extending from the supraorbital margin up to the occiput, this whole thing is the scalp. So the first nerve which is supplying the scalp is the supratrochlear. The second will be, this is sensory. As I said, out of the 10, 8 are sensory. So almost all are sensory except 2. We'll discuss them. Okay. So the second nerve is the supraorbital. This is also sensory. So this is the supratrochlear and this is the supraorbital nerves which are supplying the most of the frontal part of the scalp. So both these nerves are branches of the ophthalmic division of the trigeminal nerve. We'll go in detail about the trigeminal also later, the later stage. Right now you can see this is supplied by the 2 nerves which are coming from the ophthalmic division of the trigeminal nerve, supraorbital as well as the supratrochlear. So these are the 2 nerves in the front. Then the third nerve is the zygomatico-temporal nerve. So this is the zygomatico-temporal nerve which is supplying the scalp. So this is the third nerve which is the zygomatico-temporal. There is a branch from the maxillary division. So this area, whole thing is supplied by the ophthalmic division. This area of the skin of the face and scalp are supplied by the maxillary, and the behind part, this part is supplied by the whole part by the mandibular division of the trigeminal nerve. Trigeminal nerve, as the name indicates, it has 3 divisions: ophthalmic, maxillary and mandibular. So these first 2 are branches of the ophthalmic division, supratrochlear and supraorbital. The third nerve, zygomatico-temporal, is a branch from the maxillary. Then we have the temporal branch of facial nerve. This is the motor nerve. So that's why it is not shown here, because all the nerves which are shown here are the sensory. So one nerve will be here, that will be called as the temporal branch of the facial nerve. That is the only motor nerve in front of the ear or in front of the auricle. And the fifth nerve which is supplying the scalp just in front of the ear or the auricle will be the auriculotemporal nerve, which will be again sensory, which is a branch from the mandibular division of the trigeminal nerve. So all these are the 5 nerves which are supplying. 4 are sensory and 1 is motor, that is the temporal branch of the facial nerve. That is the only motor nerve which is supplying the scalp in front of the ear. The remaining 4 will be the sensory. So there are 5 nerves which are supplying the skin in the front of the auricle. Then the nerves which are behind the auricle, which are supplying the area of the skin of the scalp behind the ear from before backwards, will be, the first is the posterior branch of the auricular nerve. Just behind here will be the posterior branch of the auricular nerve, just in front behind the ear. Okay, this part, okay, which will be sensory, and this will be from the second and third segments of the cervical nerves. Then we have one motor nerve which is supplying the area behind the ear, that will be the posterior auricular branch of the facial nerve. Facial nerve, here also facial nerve, in the front also facial nerve. Okay, so both are branches of the same facial nerve, the motor branches. Temporal branch here, and here will be the posterior auricular branch of the facial nerve. Okay, so that is these are the only two nerves which are motor. All other remaining are sensory. The third nerve will be the lesser occipital nerve. So this is the area supplied by the skin by the third nerve, that is the lesser occipital nerve, which is again sensory, and it is from the second segment of the spinal cord, cervical segment. Then we have the fourth nerve which is supplying, that is called as the greater occipital nerve. Here is the greater occipital nerve which is supplying a large area of the skin behind the ear. So this is also sensory, and this is again the component of the second cervical nerve. Then the last nerve which is supplying the area behind the ear, which is sensory, will be the third occipital nerve. Third occipital nerve. Okay, so this will be the nerve which is supplying the area near the occiput, and this is from the third segment of the cervical nerves. Okay, so these are the five nerves which are supplying behind the ear. The posterior branch of the greater auricular nerve, which is sensory. Then we have the posterior auricular branch of the facial nerve, which is motor. Then we have the lesser occipital nerve. Then we have the greater occipital nerve. Then we have the third occipital nerve. All these are the nerves which are supplying behind the ear. So there are five in the front and five behind, which are supplying the skin in the scalp. Okay, out of the 10 of this cranial of this cutaneous nerve which are supplying the skin, 8 will be sensory and 2 will be motor nerves. Coming to the arterial supply, the blood supply of this area is by 5 arteries which are supplying the whole of the scalp. So there were 10 nerves which are supplying the skin of the scalp, but 5 arteries will be supplying the skin of the scalp. Here there will be 3 in the front which will be supplying the area in front of the ear, and 2 will be supplying behind the ear. So which are these 5 arteries which are supplying the scalp? In the front of the ear, the 3 will be, one is the supratrochlear. So just similar to that of the supratrochlear nerve, here will be the supratrochlear artery as well as the vein also. Then we have the supraorbital. So this is also similar to that of the supraorbital nerve. So there is supraorbital artery, nerve as well as the vein. So this supratrochlear artery as well as the supraorbital artery, both are branches of the internal carotid artery. So both are branches of the internal carotid artery. Okay, so the internal carotid artery doesn't give any branches in the neck, but goes inside and supplies the brain. Then from there it will come and even give some branches which are coming to the scalp. Then the third artery which will be supplying the scalp will be the superficial temporal nerve. This is the superficial temporal nerve which will be supplying. This is the terminal branch of the external carotid artery, superficial temporal nerve, which will be supplying the scalp. So this is one of the 2 terminal branches of the superficial of the external carotid artery. Okay, then the arteries which are supplying behind the ear will be remaining 2, that is the posterior auricular artery. So here if you can see here, okay, so here is the posterior auricular artery which is supplying, and the last artery which is behind the ear will be the occipital artery. So all these arteries, superficial temporal artery, the posterior auricular artery as well as the occipital artery, are all branches of the external carotid artery. So it is the scalp is a very important area for anastomosis between the branches of the external carotid artery as well as the internal carotid artery, because the supratrochlear and supraorbital are branches of the internal carotid artery, and all these remaining branches, superficial temporal artery, posterior auricular artery as well as the occipital artery, are branches of the external carotid artery. So scalp is a very important area for the anastomosis between the branches of the external as well as the internal carotid artery. Coming to the venous drainage is very similar to that of the arterial supply. So they correspond to the arteries. So there is supratrochlear vein as well as the supraorbital vein. Both are along with the supraorbital artery and trochlear artery. So these are the two veins which will be draining the area in front of the scalp. Then we have the superficial temporal vein, which is along with the superficial temporal artery, which will be draining here. Okay, then we have the posterior auricular vein, just like the posterior auricular artery. Behind is the posterior auricular vein, and then we have the occipital vein. So then we have the emissary veins. These are small veins. We'll discuss about this. These are the veins which are connecting the superficial veins in the scalp to the deep veins which are present in the cranial cavity. Okay, so these are the all the veins which will be draining the scalp. To repeat once again, supratrochlear vein as well as the supraorbital vein. Then we have the superficial temporal vein, posterior auricular vein, occipital vein, and many of the emissary veins. Coming to the lymphatic drainage, again it is divided into the area in the front as well as behind. The area of the scalp which is in the front of the ear will be drained into the preauricular as well as the superficial parted group of lymph nodes here. So the area in front of the ear, anterior part of the scalp, this whole area will be drained into the lymph nodes which are just in front of the ear. These are called as the preauricular, or they are also called as the superficial parotid lymph nodes which are present here. Okay, the area of the scalp behind will be draining into the postauricular or the mastoid group of lymph nodes as well as the occipital group of lymph nodes. So these are the two group of lymph nodes into which the posterior part of the scalp will be draining. And finally all these will be draining into the deep cervical group of lymph nodes. Now coming to a very important applied aspect related to the scalp is the dangerous area of the scalp. There is an area of the scalp which might lead to sometimes pushing of the or spreading of the infection from the outside to inside. So especially the fourth layer of the scalp, that is called as the loose areolar tissue, because it is loose and lax. So any infection there during injury or some other infection might get transferred deep inside into the important spaces, venous spaces there. So these are the emissary veins which can carry any infection which is outside the scalp into the dural venous sinuses deep inside, and this might lead to transfer of infection which is external directly into the cranial cavity and from there into the brain itself. So that's why the fourth layer of the scalp is called as the dangerous area of the scalp, because it is loose and lax, and that is the area where there can be it is prone for infection due to even slight trauma, and if there is any infection there, so it can be easily transferred into the cranial cavity and from there into the brain itself. So that's why this layer, the fourth layer of the scalp, that is the loose areolar tissue, is called as the dangerous area of the scalp. The advantage is also there because of the loose areolar of the scalp, because sometimes if there is any trauma to the scalp uh, or to the head itself, sometimes there can be intracranial hemorrhage, and intracranial hemorrhage from there because of the excessive blood collection. So that can be very dangerous for the brain if there is excessive collection of brain, and because there is no space, so it will compress on the brain. So these emissary veins which are connecting outside, so these might drain the excessive collected blood, especially the venous blood, into the scalp. So there might be a big hematoma in the scalp, but that will be actually a safety valve which will be draining all the blood which is collected in the cranial cavity and prevents the damage of the brain because of the excessive collection of blood within the cranial cavity, which is a closed cavity and there is no much space. So if there is even slight collection of blood, that might compress on the brain and it can lead to lot of dangers. So these emissary veins which are present inside, so they might start draining the vein in the opposite direction into the scalp. So this blood will be collected in the scalp and it might look like a big trauma, and there might be a collection of blood. It might look dangerous, but actually this is called as the safety valve, because it is preventing the excessive blood which is collected in the cranial cavity, and it is letting out, so that there is, and it prevents the damage to the brain. So this is called as the safety valve hematoma of the scalp, the fourth layer. So both the advantage is there of the fourth layer as well as the disadvantage. So the fourth layer is also called as the dangerous area as well as the safety valve of the hematoma of the scalp, especially whenever there is fracture of the vault of the scalp with torn dural matter, which might lead to intracranial hemorrhage, and this will drain the blood outside into the scalp, especially in the fourth layer where it is loose. So where there is a loose area, so easily the blood can collect, and that prevents the brain itself getting damaged. The third important applied aspect of this scalp is called as the black eye, especially whenever there's trauma. You might have seen in movies and other things, whenever some girl hits a boy and he will have a black eye, okay, like this. So this is especially if there is trauma to the scalp anywhere in the scalp, again the blood which is collected there, it will easily flow through this fourth layer, and because the aponeurotic tissue of the front occipitofrontalis is attached to the especially to the skin, so the area below that, that is the fourth layer, can easily drain into the loose connective tissue which is around the eye. So that's why which the blood which is collected because of the trauma in the fourth layer easily drains into the this area around the orbit, because the muscle itself, the occipitofrontalis is attached to the skin instead of the bone, it is attached to the skin, so easily the blood can go and collect around the, especially where it is loose, as well as because of the gravitational force, it will come down and it gets collected in this loose connective tissue area around the eye. That's why you can see the black eye if there is any damage, not only to the punch in the eye, but also even in any area in the scalp. So that's why it is called as the black eye, because if there is any damage to any part of the scalp, the blood will be collected around the eye and the eye becomes black. So that's why it is called as black eye. So these are the three important applied aspects related to the scalp. One is the dangerous area of the scalp, which is the fourth layer. Also the fourth layer is also called as the safety valve hematoma of the scalp. And the third important applied aspect of the scalp is the black eye, which is seen with the collection of blood around the eye. So this is about the scalp. So this is all about the scalp. If you have any doubts regarding the scalp, you can just write to me and I will try to answer. Okay. Thank you very much.